Assalamu alaikum. My name is Tubanas. My roll number is BP1650239. The drug which was assigned to me is levonorgestrel releasing implant. Levonorgestrel is a synthetic progestogen. It is a hormone that can cause changes in the cervix, making it harder for the sperm to reach the uterus and also for the fertilized egg to get attached to the uterus. A contraceptive implant is basically a flexible plastic rod which is about the size of a matchstick that is placed under the skin of the upper arm. Levonorgestrel releasing implants are long acting contraceptives approved for 5 years of continuous use. It releases a low, steady dose of hormone. The rational use of levonorgestrel releasing implants is to prevent pregnancy. They are long-term reversible method of contraception, which means whenever these implants are removed, the fertility rate will return back to normal level comparable to those women using no contraceptives. Also, it is likely to be less effective in obese women as serum levonorgestrel levels decreases as the weight increases, and hence the risk of pregnancy also increases. Now, some of the side effects associated with this drug include urinary tract infections, menstrual complaints like menorrhagia, dysmenorrhea, and premenstrual syndrome. Dysmenorrhea is basically a medical term used for menstrual cramps, while menorrhagia is a medical term for menstrual bleeding lasting for longer than 7 days. Some other side effects include pelvic pain, headache, dizziness, and increase in weight. Now let's discuss the mechanism of action of this drug. The implant releases low doses of hormone. This hormone binds to progesterone and androgen receptor and delay gonadotropin releasing hormone from being released from the hypothalamus. Now this action will prevent the luteinizing hormone surge that normally occurs during the pre-ovulation stage. Ultimately, it will inhibit the ovulation by inhibiting follicular rupture and the release of the egg from the ovaries. It also causes changes in the cervical mucus. As the cervical mucus becomes viscous and scanty, these changes in the cervical mucus makes it difficult for the sperm to reach the egg, and hence the contraceptive action of the drug will be achieved. Now, there are some conditions in which this drug cannot be prescribed. These conditions include active thrombophlebitis or thromboembolic disorders, undiagnosed abnormal genital bleeding, known or suspected carcinoma, acute liver disease, and history of idiopathic intracranial hypertension. The irrational use of this or any medicine is basically means that using too many medicines for a single patient, or the inadequate dose of the medicine, or the medicine is prescribed for a longer duration than required, or a larger dose of medicine is prescribed than required. Its irrational use can cause nausea and alter uterine bleeding patterns. It can occur if the old set of implants are not removed and new implants are inserted, or if, while using these implants, another hormonal contraceptive is used. Symptomatic treatment can be provided in the case of its irrational use, as no antidote is available. Now, there are some drugs which can interact with levonorgestrel releasing implant action, and it can reduce its efficacy or can produce side effects. So these implants are not recommended for women using phenytoin, phenobarbital, as these drug, as these anti-epileptic drugs decrease the levonorgestrel concentration and make it less effective by increasing the metabolism of levonorgestrel. Also, for women receiving long-term therapy with hepatic enzyme inducers, a different method of contraception should be considered. Women using herbal products containing St. John wort should also consider using different other method of contraception, because these herbal products may induce hepatic enzymes which may reduce the effectiveness of contraceptive steroids. Now, three alternative brands with low and high price option with respect to pharmacoeconomic point of view. The three brands are Jadel, Norplant, and Femplant. Unfortunately, these brands are either not available from the manufacturer or not available in Pakistan, and that's why the prices of these brands are not mentioned here. This drug can be present in different dosage forms. This drug is available in the form of tablets or pills and can also be administered through intrauterine devices and implants, obviously. The intrauterine devices and the implants that release levonorgestrel are much better dosage forms. Why? Because these devices or these implants have much lesser side effects as compared to the orally administered tablets. Also, they provide long-term contraception and they also have a much higher ratio of preventing pregnancies. Now, any alternate drug that can be used in place of levonorgestrel is ulipristal acetate. Because according to a new research, ulipristal acetate can be used as an emergency contraception drug as it prevents more pregnancies than levonorgestrel. It can be used up to 5 days after unprotected intercourse. Ulipristal acetate almost half the risk of pregnancy as compared to levonorgestrel. Also, we can use combined oral contraceptives containing ethinyl estradiol and norgestrel or levonorgestrel are safe and effective for use as postcoital emergency contraception. Now let's discuss the case study related to this drug. 22-year-old Amy desires contraception as she doesn't have any plans of childbearing in near future. She is currently using condoms. Her present medical history tells us that she has SLE, anemia, PE, and sickle trait. She is currently using medicines which are as follows: plaquenil, salsap, prednisone, lisinopril, aliquis, atorvastatin, and omeprazole. Her urine pregnancy test is negative and pelvic exam is normal. What method of contraception would you recommend? Now, first we will see what information is available in the question about our patient. She is a female of 22 years of age. She desires contraception as she has no plan of childbearing in near future. Her medical history suggests that she is suffering from a condition known as SLE. She also has anemia, PE, and sickle trait. The current medications which she is still using are plaquenil, salsap, prednisone, lisinopril, aliquis, atorvastatin, and omeprazole. Her laboratory data suggests that her urine pregnancy test is negative, pelvic exam is normal, and when she had come for insertion of the implant, at that day her chlamydia test was done, and the reports came on the next day, which tells us that she is positive for chlamydia. We will assess the case in this way: that she is nulliparous, which means she has not given birth or has no children. She is also suffering from an autoimmune disorder known as SLE, along with anemia and pulmonary embolism. She also has sickle cell trait. She is looking for a more reliable and long-term method of contraception and is currently using condoms. Now, if we consider the effectiveness and side effects of different methods of contraception, it shows that condoms are not a long-term solution and have a much higher chance of pregnancy. On the other hand, if we consider CHC, which is known as combined hormonal contraception or contraceptive, it means that she is prescribed with the pill, the ring, and the patch, all three for the contraceptive purpose. This method has more risk than benefit. Why? Because she is suffering from systemic lupus erythematosus. In this condition, she has a subcondition which shows that she is positive for antiphospholipid antibodies. Antiphospholipid antibodies are a group of immune proteins that the body produces against itself in an autoimmune response to phospholipids. In this condition, she cannot be prescribed with combined hormonal contraceptive method because there are more risks than benefits. Also, she is suffering from pulmonary embolism, in which there is a blood clot which is blocking the lungs. And the oral contraceptive pills can increase the risk for more blood clots. Also, ring cannot be used here for contraception as it is not recommended in women with clotting problems. So, this method of contraception cannot be considered in this case. If we consider the injection for contraception, it's more problematic, as the person has to be injected with the hormone every 3 months, and then she has to come to the hospital after every 3 months, which is problematic for the person. And it can also lead to irregular bleeding and bone density loss. And using this can delay the return of fertility. Now, if we consider copper non-hormonal intrauterine devices, they're much more painful and has a higher chances of causing pelvic inflammatory disease. If especially if the person is positive for chlamydia, which is present in this case. So this method of contraception can also not be used. Now, if we see that only implant seems to be the best option for her, so we can insert levonorgestrel releasing implant, as it will have less side effects and have more benefit than risk. If we consider the condition from which she is suffering, which is SLE, that is systemic lupus erythematosus, and obviously the subcondition from which she is suffering, which is which shows that she is positive for antiphospholipid antibodies. So levonorgestrel releasing implant is used as a long-term contraceptive method in this case. We can use JADL for this case. These are basically two cylindrical implants containing 75 milligram of progestin levonorgestrel, which and are inserted in the skin of upper arm. This implant will be effective for 5 years, after which she can come back to the hospital for its removal. And if she wish, we can insert a new pair of implants in her arm if she wish to continue the contraceptive process. The total administered dose for the implant is 150 milligram, and it has to be inserted during the first 7 days following the onset of menses. As after the insertion, the lab results that came out on the next day indicate that the patient is positive for chlamydia, and also she was asymptomatic. For this, she can be given a single dose of azithromycin or doxycycline, which can be given as 2 capsules a day for a week. Also, for her condition of SLE, she is taking Plaquenil, Salcept, and Prednisone. And for her pulmonary embolism, she is taking Eliquis, which is an anticoagulant. Here are the references from which help has been taken to prepare this presentation. Thank you.